Hello friends, welcome back to my channel. I hope you all are doing well. देखते ही देखते this is the end of the December, last week of December. So now you'll be having your new year. So lots of festival. You will be having Pongal. Pongal is celebrated in different parts of India in different names. So but your festival will start once you give your NEET MDS 2024 exam, and once you will get your dream branch along with your dream college, so your festival will start from that day only. So remember, till now you have to focus on your study, you have to give your best in NEET MDS 2024. So Merry Christmas to each and everyone. So today we will study another topic of pharmacology, that is anti-malarial drug. As you all for pharmacology is one of the hardest subject for dental students. It varies among person to person. I don't know everyone is having difficulty in this subject or not, but when I was an aspirant, I have a difficulties in remembering the drugs of pharmacology, even the classifications, the drugs. It is a one of the kind of volatile subject, and I am having lots of difficulties in this subject. So I feel like this subject is difficult for most of the aspirants. So today we'll cover one of the topic of pharmacology, that is anti-malarial drug. I am trying to make you understand this topic in a simple way, in a concise way, so that you will remember the drugs, you will understand the concept, and you will remember the drugs in a easy way. So let's get started. Anti-malarial drug. Malaria is one of the most common diseases in India, and as you all know, malaria is not caused by any virus, not caused by any bacteria. Rather, malaria is caused by the parasite that belong to the genus Plasmodium. So firstly, we'll discuss the life cycle of the parasite malaria. So firstly, mosquito, when it bites man, and they will release sporogyte, and sporogyte is the infective form for man. In the mosquito, the life cycle or sexual cycle of the parasite takes place, and in man, asexual cycle takes place. When the sporogyte enters the liver, then pre-erythrocytic schizogony phase takes place. Once it enters the liver, then after entering the liver, the sporogyte is converted to merogyte. Then again, merogytes are two types, micro and macro. The micromerogytes enter the RBC, and once it enters the RBC, then erythrocytic schizogony phase takes place. In this phase, the maturation and multiplication of merogyte occurs. Thus, once entering the RBC, merogytes converted into trophozyte, and then from trophozyte it converted to immature schizone, and then it again converted to mature schizone, and ultimately it gets converted to gametocytes. And again, mosquito takes gametocytes from man, and in the mosquito these gametocytes are converted into sporogyte. Thus sporogyte is the infective form for man, and gametocyte is the infective form for mosquito. Again, the macromerozytes re-enter RBC, and exoerythrocytic schizogony cycle takes place. This exoerythrocytic schizogony phase is lead to relapse of the malaria. This phase is absent in Plasmodium falciparum. I will discuss it later on. So thus this cycle continues. So firstly, mosquito will bite the man, and it will release sporogyte. Then sporogyte will enter the liver, and again in the liver the sporogyte will convert it to merozyte. Merozytes are two types, micro and macro. Macromerozytes are responsible for relapse of the malaria disease, and micromerozytes enter RBC. Again merozytes are converted into trophozyte. From trophozyte it will get converted to schizone. Again schizone to mature schizone. This everything are going inside the RBC, and again from mature schizones it will get converted to gametocytes. Thus, when mosquito will bite man, they will again take the gametocytes. Thus, in the mosquito, gametocytes is the infective form, and in the man, sporogyte is the infective form. There are four kinds of Plasmodium parasite. Firstly, Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, and Plasmodium malaria. This Plasmodium falciparum is most common in India, and in Plasmodium falciparum all the life cycles continues except this exoerythrocytic phase. This exoerythrocytic phase is not occur in Plasmodium falciparum, thus relapse is not commonly seen in India. As I already told you, this exoerythrocytic schizogony cycle is responsible for the relapse. Now coming to the drugs that are used for the treatment of malaria. Drugs are used in each phases of the life cycle of malaria. Thus, firstly, to block the erythrocytic schizogony phase. This means to block the entry of the sporogyte into the liver. The drugs that are used, they are known as causal prophylaxis. Then, to block the erythrocytic schizogony phase means to block the entry into the RBC. The drugs that are used are known as clinical cure or suppressive cure. Then to block the exoerythrocytic phase means to block the relapse of phase, the drugs that are used are known as radical cure. And then to block the gametocytes, that is the formation of gametocytes from merozyte, the drugs that are used are known as prevention of transmission phase. Thus the drugs are used in 4 phases of the life cycle of the malaria parasite. So the drugs that are used for the causal prophylaxis, so remember how to remember the drugs that are used for causal prophylaxis. Remember, causal prophylaxis starts with P, so the drugs are known as PPP. First is proguanil, then pyrimethamine, and then primaquine. Then the important question that they used to ask in NEET MDS, that primaquine can cause methemoglobinemia, as well as it also cause hemolysis in person with G6PD deficiency. So thus primaquine is contraindicated in pregnancy as well as individual with G6PD deficiency. Then for the second step blocking, the drugs that are used are known as clinical cure drugs or suppressive cure drugs. So under these, the drugs that fall under are chloroquine, quinine, mepacrine, all other drugs, and artemisinin derivative, that is ATC derivative. Then to block the radical cure stage, the drugs that are used are known as primaquine. Then to block the transmission phase, the drugs that are used for P5X only, the drugs used are chloroquine, quinine, and mepacrine. The chloroquine is the drug of choice for malaria in pregnancy. This is the question that they used to ask in NEET MDS. Then again, quinine can cause hypoglycemia, so IV infusion always given in 50% dextrose solution. Then for the drugs that are used for treatment of P. falciparum, they are pyrimethamine, proguanil, and primaquine. Primaquine is again effective against both 5X and falciparum, and primaquine is the only drug that prevents the relapse of the malaria. So while we are reading malaria, the most important drug that they used to ask, that is chloroquine. Chloroquine is the most important drug that is used for the treatment of malaria. So the chloroquine is very important, and they used to ask most commonly the uses of chloroquine and the adverse effect related to chloroquine. Mostly they used to ask in the exam. Then comes to the important question that they used to ask mostly, like for uncomplicated malaria for P5X and P. ovale, the drug of choice is chloroquine and primaquine. Then for P. falciparum and P. malaria, the drug that is commonly used is artemisinin derivative, that is ACT, and along with primaquine is used. For chloroquine resistant P. falciparum infection, both for treatment as well as for prophylaxis, mefloquine is used. As I already told you, the chloroquine is the most important drug while we are dealing with malaria. So here I will tell you the other uses of chloroquine. So how to remember the other uses of chloroquine? Let us remember it using a simple trick. That is red leaf Mahatma Gandhi. So from R, that is chloroquine also is used in rheumatoid arthritis. E, extraintestinal amoebiasis. Then from D, discoid lupus erythematosus. L comes to lepra reaction. And then in eye infectious mononucleosis also we use chloroquine. Then for photogenic reactions, then malaria, and in giardia, that is red leaf Mahatma Gandhi. You can remember the uses of chloroquine by this simple trick. Chloroquine is again deposited in retina, so the adverse effect, they used to ask that question, that what are the admins, like they will give you 4 options and you have to tick the correct answer. That is, the adverse effect of chloroquine is option A, option B, option C, option D, like that. So among this option, one of the option they might give peripheral neuropathy, then blindness, then porphyria, skin rash, hypotension, myocardial depression. These are mostly the most common adverse effect of chloroquine. So now let's revise the whole section in a simple glance. So firstly, the mosquito will bite man and it will release the sporozoid. The sporozoid is the infective form for man. Then sporozoid will enter the liver and pre-erythrocytic schizogony phase will start. And again in the liver, that sporozoid will convert it to merozoid. Merozoids are again macro and micro. The micro merozoids will enter the RBC and erythrocytic schizogony phase will take place. In here, maturation and multiplication of sporozoid will occur. Then micromerozoid will convert it into trophozoid in the RBC. Then trophozoid will be converted to immature schizone. Then from immature schizone it will get converted to mature schizone, and mature schizone ultimately gets converted to gametocyte. So when mosquito bites a man, it will take the gametocytes, and again the gametocytes will convert it to sporozoid in mosquito. Thus for mosquito, the infective form is the gametocyte. The 4 kinds of plasmodium that are commonly seen are Plasmodium vivax, Plasmodium ovale, Plasmodium falciparum, and Plasmodium malaria. The Plasmodium falciparum is the most common in India, and in Plasmodium falciparum no exoerythrocytic phase occurs, so relapse is not commonly seen in India. Now coming to the drugs, drugs are used in each phases of the life cycle of the malaria parasite. Firstly, to block the pre-erythrocytic schizogony phase, means to block the entry into the liver, the drugs that are used known as causal prophylaxis. Then to block the erythrocytic schizogony phase, means to block the entry into the RBC, the drugs that are used known as clinical cure or suppressive cure. Then to block the exoerythrocytic phase, means to block the relapse phase, the drugs that are known as radical cure. Then again to block the formation of gametocytes, the drugs that are known as prevention of transmission phase. Then the drugs that are used for causal prophylaxis, to remember PPP. So firstly proguanil, then pyrimethamine, and then primaquine. Then the drugs that are used for clinical cure or suppressive cure are chloroquine, quinine, mepacrine, all other drugs, and artemisinin derivative. The drugs used for radical cure are only one drug, that is primaquine. Then for the prevention of transmission phase, the drugs that are used for P. vivax only are chloroquine, quinine, and mepacrine, and for P. falciparum, the drugs are pyrimethamine, proguanil, and primaquine. Then for treatment of uncomplicated malaria for P. vivax as well as P. ovale, the drugs used are chloroquine along with primaquine. And for treatment of malaria caused by P. falciparum or P. malaria, the drugs commonly used is, that is drug of choice, is artemisinin derivative along with primaquine. And for chloroquine resistant P. falciparum infection, both for treatment as well as prophylaxis, mefloquine can be used. Now coming to the uses of chloroquine, I already told you how to remember this, that is red leaf Mahatma Gandhi, that is R for rheumatoid arthritis, E for extraintestinal amoebiasis, D for discoid lupus erythematosus, L for lepra reaction, E for infectious mononucleosis, P for photogenic reactions, M for malaria, and G for giardia. As chloroquine is deposited in retina, so the adverse effect they commonly used to ask, so the adverse effect are peripheral neuropathy, blindness, porphyria, skin rash, hypotension, and myocardial depression. So now I hope this topic is easier for you. Now you can answer any questions that they will ask in NEET MDS. From this whatever I give you the notes, whatever I tried to make you understand. Now I think you can answer all the questions whatever they will ask in the exam. You just go through my notes and you follow the book Sparsh Gupta. Try to mark all the questions, try to solve the questions, try to solve the MCQ whatever they have given in Sparsh Gupta, whatever is asked in previous year questions, and you follow my notes. You can easily solve all the questions whatever they will ask related to malaria. So today I am ending my video here only. Any doubt, any queries, any fear regarding exam, anything you want to know, you can always write in my comment section. So next time we'll come up with another video. Till now, keep studying, keep reading, and be positive. Stay healthy, and good night.